Okay, this is great. Thank you everyone for filling in the poll. So we've got an audience mainly of people in youth work, practitioners, also people in youth and health in managerial roles, some young people, some people from higher education in sort of academic roles, and some students, so but mainly youth work. So thanks everyone for completing the poll. What I might do then is, because I haven't had anything in the, oh, here we go, lots in the chat now. Okay, great. Okay, so people saying they come across, so from Claire, we come across all sorts of emotional and mental health difficulties across all levels of our service, and we support young people with low-level difficulties to high-level difficulties. Okay, this is great, thank you. Okay, so somebody, Andy Spencer, saying if we could put some advice about some simple tips to help support mental health while people wait for specialist help. So I'm going to try and do that at the end of the talk today. Okay, and so we've got a range of, I guess, support roles with people supporting young people with sort of lower level difficulties and very significant difficulties needing specialist help. Okay, so there's clearly lots of people who are supporting young people in their roles and in mental health. Okay, thanks everyone, this is brilliant. Okay, so what I'm going to do and talk about today is really try and give you an overview. I've got somebody come up on, okay, so somebody wants to say something, so I'll just let somebody in and then I will have a go at doing some talking through some of the presentation. So this is Conway Hawkins. Okay.
And then, sorry, I just tried to join you.
Hi. Did you have a question, Conway?
No, sorry, I just clicked to join you and I didn't ask to come.
Oh, okay. Okay, so a really interesting and mixed group of people here working lots of different sectors and charities. And so I'm going to give an overview of mental health in young people. So really focusing on anxiety and depression, and to give you some sort of research findings, but also to try and point you towards some simple, I suppose, areas of help and things that might be helpful in supporting young people with sort of more mild to moderate difficulties. So I should introduce myself. I'm Frances Rice. I'm a professor at Cardiff University. So I'm coming at this from quite an academic perspective. I'm co-director of a research centre called the Wolfson Centre for Young People's Mental Health, which focuses on anxiety and depression in young people. And so so I've asked what people's roles are, and then we've got lots of helpful comments in the chat and informative comments in the chat about the extent to which I suppose young people are being supported about mental health in their roles. And so I will try and give you some information that might be helpful. And if you have particular questions or follow-ups, if we run out of time, then I can be contacted at this the email address on here, and I will sort of do my best to answer questions. But I'm coming at this very much from a sort of research perspective rather than a kind of practice perspective, I suppose. So what I was going to do was just tell you I can see lots of chat here, but I can't read it all at the same time. So I can see there's some chat. So I'll have a look at those as I go along and try and perhaps pick up with people afterwards. So I'll tell you a bit about what our centre does very briefly. But what I'm going to do is just introduce anxiety and depression in young people, some definitions, a bit about how common they are, what the influence of the pandemic has been, some risk and protective factors, and I'll focus on a couple of examples from research findings, And then I've really been asked to try and give some practical hints and tips about what might be useful resources, and certainly in speaking to practitioners in this area, my impression is there's lots of information available, but it sometimes be quite hard to sift through that information and to know what the quality of the information is. So I'll try and provide some support there. So at the Wilson Centre for Young People's Mental Health, we're a research centre. We really tried to do research focusing on understanding anxiety and depression. We know that they're complicated things to deal with and complicated problems, if you like, to try and answer. And so a key part of what we're trying to do is to try and work with, in partnership with young people, with representatives from health and education and charities, as well as government and policy makers. And that's really to try and use scientific findings to inform policy and practice, and also potentially to use research as ways of evaluating changes in policy and practice. And what we aim to try and do is to address research questions that can have the potential to make a difference to young people. So focus on questions of importance to young people themselves and those who work with them. So I'll give a bit of an overview about anxiety and depression and really focus on this main part of the talk. So as many of you will be quite well aware, I'm sure, that mental health difficulties exist on a spectrum, from mild to moderate and severe. And clearly, when we're talking about things like anxiety and depression, these are words that we use in ordinary everyday life, and we may all experience sort of normal ups and downs. But when we're talking about mental health difficulties, we're talking about something that's more persistent and might cause distress and impairment in somebody's everyday life. And there are, if you like, different categories of types of mental health difficulties that people can experience. And this is, by no means a complete and definitive list. They can be put into categories. So emotional problems, which I'm going to talk about mainly today, which is anxiety and depression. Also behavioural problems, so things like being disruptive, not kind of following rules, and maybe being kind of quite explosive with temper and being irritable. And then there are other sorts of difficulties which aren't necessarily mental health difficulties, but do co-occur often with mental health difficulties, and that's neurodiversity, like autism and ADHD. And it's also the case we know that these types of difficulties often co-occur. So a young person might experience several of these types of difficulties. We also know that mental health problems often start before adult life, so in the very high rates of continuity of mental health difficulties into adult life, though some young people do function well. And these types of difficulties are associated with distress for the young person themselves and those around them, but also with problems with learning, with friendships, with being able to function in home life. And these types of difficulties do tend to be more common in certain groups of young people, and I'll give some examples of that later on. But of course, they are indiscriminate, I suppose, in who they affect. So when we're thinking again about mental health, it's helpful sometimes to think of it as a spectrum. But when we're talking about mental health difficulties, these can behave, if you like, as continuous scores. So where some people have none, some people have some, and some might have a lot. And that has parallels with other areas of medicine, for instance, where blood pressure exists on a continuum, and only at the extreme end do you have a condition like hypertension. So categories or disorders, when we're talking about mental health, can be useful in some circumstances. And here we're talking about mental health problems towards the more severe end of the spectrum, difficulties that co-occur together, and also importantly that cause impairment and distress. And they can be helpful for clinical purposes, for instance, whether a doctor might refer a young person on for more specialist treatment. But these sorts of difficulties do behave as continuous traits as well. So just in terms of definition, and you know, many of you will be really familiar with this, but here I'm sort of talking about what we call depressive or anxiety disorders, and really depressive disorders are clearly about low mood, and that's mood that's of a different quality from the normal ups and downs that we might all experience in life. Also symptoms around really just not enjoying things that ordinarily would be enjoyable, and mood can be quite irritable as well. With depression, you often see physical symptoms too. So these are symptoms around sleep, appetite, being very tired, and then also the way in which we think about things changes. So depression is associated with being very bleak and pessimistic about the world, feelings of sort of self-hatred and thinking that one is a bad person. Anxiety, by contrast, has lots of, well, I suppose it has lots of similarities, but the key symptom really is about worry and fear. And this is worry that's disproportionate to the situation, and it's of a great intensity. And then also there are physical symptoms, again, associated with depression. So here, being very restless, difficulty sleeping, and then these sort of physical symptoms around feeling incredibly anxious, where you might have palpitations, sweating, and these sorts of things. So that's really just to give you a kind of flavour about what we call these types of conditions, because clearly there's variation in terminology. I'll skip over this. This is just for slides for just sharing if people are interested in them. In terms of how common these sorts of problems are, so here's some data from a survey in England, so run by NHS Digital, the Office of National Statistics. And before the pandemic, estimates were about 1 in 10 children had a mental health disorder. So this is severe enough to cause impairment and distress and have persistent difficulties. And about 1 in 12 were estimated to have an emotional disorder. And then recent data from a follow-up survey of this group carried out during the pandemic last year showed that this rate had increased, a probable disorder increased to 1 in 6. We also know that emotional problems, anxiety and depression are more common in particular groups of young people, so more common in females, particularly older females. So again, this is data from the Office of National Statistics. There's some ethnic differences, children with additional educational needs, where a parent is mentally distressed themselves, and children whose physical health is poor, and also less well-off families are more commonly experience these types of difficulty. There are also a number of, risk and protective factors that are, if you like, kind of go along with anxiety and depression. So, and these are things that within the person and within the kind of environment or the systems that they live in, really. So, poverty, mental health difficulties in a parent, but then stressful life events are really important as well. And if you like, the context of the family environment. Protective factors include, really good quality relationships with friends, with a family member, as well as having sort of a positive outlook on life. And these types of positive factors can also enhance resilient mental health in people who are have experienced other types of risks. So I mean, I just give you a sort of very general overview about anxiety and depression, and many of you may already be familiar with that, but just to highlight that these difficulties are often missed in young people and they don't often seek help. And there's obviously a lot of complicated reasons as to why that might be, but they can be hard to recognise. So there are subtle differences in the sorts of symptoms, for instance, that young people who are depressed experience versus adults who are depressed, where the physical symptoms of depression are much more common in teenagers than in adults. So where teenagers are more likely to present with problems with sleep and appetite and tiredness than are adults, and that can make this difficult for professionals to pick up. Also, these types of difficulties often co-occur with other sorts of challenges, and that can obscure the picture. So, for instance, somebody who is unhappy may start to refuse to go to school, use drugs, etc., and it's hard to know what is driving those difficulties. There's also stigma and around seeking help for mental health difficulties, and we need to sort of acknowledge that this is something that's quite difficult for young people to do sometimes. So I'm going to give you two examples of some research that we've done, one looking at long-term patterns of symptoms of depression and one looking at depression and anxiety in families. And then I'll sort of finish off with some practical tips, and I'll try and look at the chat and answer some of those questions. So the first example is really looking at depression over time. And so this is a large study using information from young people who've completed assessments from the ages of 10 up to 25, and they've reported on their depression on multiple occasions over that time. And what we were interested in trying to find out here was, we know that for some young people, they can recover from depression and that they function well as adults in adult life and do well in terms of their mental health. And for others, their difficulties persist. And so we were interested in trying to understand what might differentiate these two groups of young people who experience depression as teenagers, in order to try and, I suppose, improve outcomes and understand how that might be done. And so, sorry, you may not be able to see this very well, but essentially what we do is we use an analytical technique, and we pull out different patterns of depression over time. And so the key groups here are the green one, where depression sort of scores go up and start to go up quite early in life, and then they remain high. And then there's a yellow group where the symptoms sort of start to go up and peak and then go down. And what we find, the differences between these two groups are, we've got a group whose depression peaks at around 17 or 18, but then it falls off and they seem to do really quite well as in adult life. And actually their functioning in adult life is as good as the group who haven't experienced depression in the past. Whereas this group whose depression persists, the green group, they have an earlier onset of depression, so around the age of 13, and they also experience greater early and continuing adversity, as well as a higher genetic loading for depression. And I guess the kind of key sort of practical message of this type of research, which again is quite academic, but it's really about trying to overcome barriers to help seeking and trying to improve access to early intervention across a wide range of settings to try and circumvent some of these poor outcomes that we see for young people whose depression persists over time. Okay, and I'll take one more research example, then I'll give some practical examples. So a second is depression in families. So we know that lots of young people in the UK and around the world have a parent who has a mental health difficulty themselves. So most commonly this is anxiety or depression, and about a quarter of children under the age of 16 in the UK experience this. And we know that this is associated with an increased likelihood of difficulties in the children, though that's not by any means inevitable. And there's evidence to show that at least in teenage years, about 1 in 5 young people in this group has really good, sustained, positive mental health. And that's associated with a range of factors, including having good quality relationships with friends and with a parent, having an optimistic outlook on life, and as well as things like regular physical exercise. I'm going to skip over this next part quickly and try and get some practical examples. So in terms of practical evidence, the guidelines on depression and anxiety are very similar, but I'll just focus on the depression guidelines here because they're a little bit more straightforward to pull out, because the anxiety guidelines are in various different sections. So the guidelines really show that what is helpful will vary according to severity and setting. And so lots of young people who've got mild symptoms of depression and anxiety will get better on their own. And what the guidelines recommend is what's called watchful waiting. And that's a bit more than waiting, but it's giving somebody an assessment and some information about their condition. And for many, that's enough. Talking therapies are the first line of treatment for kind of more moderate difficulties, and actually across the range. And there's a range of therapies that are suggested. So cognitive behavioural therapy, interpersonal therapy, and supportive non-directive therapy are all evidence-based therapies. And then NICE also gives recommendations on when to refer to specialist mental health services, which is really around self-neglect. So not washing, not looking after yourself, not eating, and active suicidal ideas or plans. But let me just fast forward to some things that can be helpful. So as many of you will know, it's very difficult to access evidence-based psychological therapy outside of specialist services, and specialist services are under lots of pressure at the moment. There's increased demand, and waiting lists can be long. But at least for mild to moderate difficulties, there are a number of sort of strategies that can be helpful in managing anxiety and depression. And essentially, the evidence-based treatments give us some information about what can be helpful. So yes, the key things are having some good quality information or psychoeducation about these types of conditions, and things like the importance of just lifestyle factors like sleep and diet and exercise in managing stress and mood and anxiety. And I'll show you what some of the best sources of information I think are at the end. And then I guess other key things are really the importance of active listening and support, particularly from a trusted adult or a friend. So young people really feeling that somebody is listening to them without judgment. Activity scheduling is again important, and this is encouraging engagement in meaningful and enjoyable activities. And common things that people do when they're feeling very low is really sort of withdraw and don't engage in these sorts of activities, and that can have the inadvertent effect of really making them feel worse. And then I suppose also just challenging negative styles of thinking and encouraging more positive thinking in a sort of rational way. And let me show you some resources, because I can see that we're already running out of time. So as many of you will know, research really shows that young people experience delays in accessing help, or many don't access help, and there's complicated sets of reasons as to why that might be. But signposting young people to good quality information can therefore be really helpful. And the two best sort of online sources of support, I think, are from the Anna Freud Centre and from Young Minds. So this is something from the Anna Freud Centre webpage, where they've got something called On My Mind, and it includes lots of information and resources, but also there's a wellbeing directory, so you can put your postcode in here and find out about resources and support that's available in your area. And there's also some crisis text support. And there will be lots of other sources of information and local information that are available, but I'm just picking these out as 2 examples. And then Young Minds has got some good quality information on it, really particularly around those who work with young people, and it's got some good info here. So that's just an example of what's on the website. So other useful sources of information are here, and there's also a repository of a mental health toolkit that's been developed by Welsh Government on Hub, which is used in lots of educational settings, and that's got a sort of repository of different sources of help and apps that people can try. So, I mean, I hope I've just been able to give you a bit of a flavour of emotional problems, that they're really common, they involve complicated sets of causes, and they often go undetected, and people don't access help. So sort of simple actions can be quite helpful, particularly if you've managed to detect difficulties early in young people and where they're experiencing sort of mild to moderate difficulties. So with that, I just want to say thank you for listening. I'll have a look at the chat. If people have got particular questions, we've done the half an hour, but we started a bit late, and there's still a gap between the next session. So I'm happy to try and take questions, and I will endeavour to answer some of the chat questions later. So slides are available, and the recording's available as well. So somebody's asked about the genesis of problems. So community and social factors are really important, and I hope I haven't given the impression that they're not. So things to do with the causes of anxiety and depression really, I guess, involve multiple causes at the individual, the family, and the sort of wider community level. And social factors are incredibly important for things like anxiety and depression, in particular, being from a kind of poor family, socioeconomic inequalities, these sorts of things seem to be incredibly important for these types of difficulties. So if anyone does have a question that they'd like to ask, you can ask it on the moderation panel. I think that's at the top right hand of your slide screen. Otherwise, I'll try to just answer a couple of questions I can see in the chat. So the point about COVID and mental health, and why that might have had this impact on young people's mental health. It's going to be a complicated set of factors, and there is ongoing research, and I know work to try and understand what some of the causes of the harms of lockdown on young people may have been, in order to try and mitigate some of those sort of negative effects. So question from Tim about Tim OP about working with youth work, and very happy to have discussions around that and how best to do that. So we've been working with Welsh Government, and particularly around the whole school approach, but certainly we know that the sort of transition kind of out of full-time education and into work or into higher education is a really important sort of transition point for young people's mental health. It's also a period where the rates of difficulty often go up, and so I would be really very interested in having discussions about how to involve youth work in our work, and happy to pick that up offline. One point about disabilities and additional needs, and you're completely right, Rebecca. So young people with disabilities and additional needs are a vulnerable population for mental health and well-being, and certainly there's strong evidence to suggest that this group is in need of additional support. And I guess one of the things that we're also not sure about is how to adapt interventions for young people who might have additional learning needs, and how to ensure that those evidence-based interventions are suitable and personalised to them. So I've tried to answer as many questions in the chat as I can. If you've got things that you would like to ask or like to get in touch with me, the slides will be shared. I'll share those with Ellie, who organises the conference. And just want to thank you very much for coming, and thank you for your time, and hope you enjoy the rest of the afternoon. Thanks very much.